Your blood sugar spikes are not random. And what I'm about to share with you might make you uncomfortable, especially if you've been faithfully taking your prescriptions. Because there is something sitting in your kitchen right now that may stabilize your post-meal blood sugar within days. Yet almost no endocrinologist talks about it. I'm Dr. Christina Serrati. And today, I need 4 focused minutes from you, especially if you're over 60 and tired of the blood sugar roller coaster. Let me ask you something. Have you ever checked your glucose 2 hours after eating, and felt your stomach drop when you saw 200? Then later felt shaky, sweaty, anxious, only to discover you crashed to 70? That violent swing, spike then crash, is not just uncomfortable. It damages blood vessels. It strains your pancreas. It accelerates nerve injury and kidney stress. And many people are prescribed medications that slow carbohydrate digestion to blunt those spikes. On paper, that sounds reasonable. In reality? Those drugs often ferment undigested carbs in your colon, leading to gas, cramping, bloating, and urgent diarrhea. I've had patients tell me they'd rather live with the spikes than stay chained to a bathroom. So here's the part no one explains clearly. There is a spice, a very specific variety, that improves insulin sensitivity and reduces post-meal spikes significantly. But most people are using the wrong type. The spice is cinnamon. But before you feel relieved, pause. If your bottle just says cinnamon and cost a couple of dollars, you are almost certainly using cassia cinnamon. And this matters. Cassia cinnamon contains high levels of a compound called coumarin. In excessive amounts, coumarin can stress the liver. Daily high intake is not something I recommend, especially for seniors already on multiple medications. The variety you want is Ceylon cinnamon, sometimes labeled cinnamomum verum. This is often called true cinnamon. It contains dramatically lower levels of coumarin and is safer for regular use. Now here's where this gets interesting. Clinical research shows that adding the correct form of cinnamon to meals can significantly reduce post-meal glucose spikes, sometimes by around 20 to 30%, depending on the individual. And it doesn't work by blocking digestion like certain medications do. It works by improving how your cells respond to insulin, which means fewer spikes and fewer crashes. In the next section, I'm going to tell you about a 68-year-old patient who came to me exhausted from glucose crashes, and what happened after we made one simple change. But before I continue, last fall, a 68-year-old man, I'll call him Robert, walked into my clinic looking completely drained. Not just tired. Defeated. He wasn't struggling because his blood sugar was constantly high. He was suffering because it was wildly unstable. Every morning his fasting glucose sat around 115 to 120. Not terrible. But after breakfast? Oatmeal and a banana would send him to 220, sometimes 230. 2 hours later? He'd crash into the 60s. Shaky. Sweaty. Heart racing. Brain fog so thick he couldn't concentrate. That's called reactive hypoglycemia. And it's incredibly common in adults over 60 with insulin resistance. Here's what's happening. When blood sugar spikes quickly, your pancreas panics. It releases a surge of insulin to bring it down. But in insulin-resistant individuals, the system overshoots. Too much insulin. Too fast. And suddenly your blood sugar plummets. So Robert lived in a daily loop: spike after breakfast, crash mid-morning, spike after lunch, crash mid-afternoon, spike after dinner, crash before bed. That roller coaster is exhausting. It keeps your nervous system in fight-or-flight mode all day. His endocrinologist reviewed his glucose monitor graphs and prescribed a medication designed to slow carbohydrate breakdown in the intestine. In theory, it reduces spikes. In reality? The undigested carbohydrates travel to the colon, where bacteria ferment them. Gas. Bloating. Cramping. Urgent diarrhea. Within 1 week, Robert quit. He told me, "Dr. Serrati, I'd rather deal with the spikes than live like that." So I asked him a question no one else had asked: "Are you using cinnamon regularly?" He laughed. "For flavor?" "No," I said. "For metabolic stability. Specifically, Ceylon cinnamon. Not cassia." Ceylon cinnamon contains powerful polyphenol and natural compounds that enhance insulin receptor sensitivity. That means your cells respond to insulin more efficiently. When cells respond better, your pancreas doesn't need to flood your bloodstream with excess insulin. So the spike becomes smaller. and the crash disappears. But dosage matters. Too little? Nothing changes. Too much, especially combined with medication, and glucose can drop too low. I instructed Robert to use 1 level teaspoon of Ceylon cinnamon with each major meal. Not once daily. With each meal. Because cinnamon works during digestion, when glucose is entering your bloodstream. He was skeptical, but desperate enough to try. What happened over the next 7 days surprised even him. In part 3, I'll walk you through exactly what changed, day by day, and explain the science behind why this works so quickly. Robert started the protocol the very next morning. 1 level teaspoon of Ceylon cinnamon stirred into his oatmeal. Nothing else changed. Same breakfast. Same lunch. Same dinner. No new workouts. No medication adjustments. Day 1, his post-breakfast spike hit 195 instead of 230. Still elevated. But noticeably lower. 2 hours later? Instead of crashing into the 60s, he landed at 92. No shaking. No sweating. No heart racing. That alone caught his attention. By day 3, his post-meal numbers were consistently 30 to 40 points lower than the week before. More importantly, the crashes were gone. And this is where most people misunderstand what cinnamon actually does. It does not block digestion like certain medications. It works upstream. Let me explain. When you eat carbohydrates, bread, rice, fruit, pasta, they break down into glucose. Glucose enters your bloodstream. Your pancreas releases insulin. Insulin binds to receptors on your cells, signaling them to absorb glucose. But with insulin resistance, those receptors don't respond well. So your pancreas compensates by producing more insulin. The problem? That flood of insulin often overshoots the target. Spike. Then crash. Ceylon cinnamon contains bioactive compounds, including cinnamaldehyde and specific water-soluble polyphenol, that enhance insulin receptor activity. In simple terms, it makes your cells more responsive to insulin. When cells respond better, you need less insulin to move glucose out of the bloodstream. That means, smaller spike, lower insulin surge, and no dramatic crash. Cinnamon also slightly slows gastric emptying, meaning food leaves your stomach more gradually. When glucose enters the bloodstream more slowly, your body doesn't panic. The spike flattens naturally. By day 7, Robert's glucose monitor showed something he hadn't seen in months: stability. Post-meal peaks stayed below 165. No drops below 85. Energy steady all day. And here's what surprised him most. His cravings disappeared. When you stop crashing into hypoglycemia, your brain stops screaming for sugar. That alone helped him naturally eat smaller portions without trying. Now let's talk about something extremely important. Type matters. If Robert had used cassia cinnamon, the common grocery store version, daily at that dose, he could have stressed his liver over time. In part 4, I'm going to explain exactly why Ceylon and cassia are not interchangeable, and how to make sure you're choosing the safe one. I need you to understand something clearly. Not all cinnamon is the same. And if you're going to use this daily, especially after 60, the distinction is critical. There are 2 main types sold worldwide: cassia cinnamon and Ceylon cinnamon, also called true cinnamon or cinnamomum verum. Most supermarket cinnamon in the United States is cassia. It's darker, stronger, cheaper, and usually just labeled cinnamon. Cassia contains significantly higher levels of a natural compound called coumarin. Coumarin in small amounts isn't dangerous. But chronic high intake, especially daily, can stress the liver. European food safety authorities established a tolerable daily intake limit for coumarin based on body weight. Here's the issue: using large amounts of cassia cinnamon every day to manage blood sugar can exceed that safety threshold in some individuals, particularly smaller adults. And many seniors are already taking medications processed through the liver. Stacking stressors is not something I recommend. Now let's compare that with Ceylon cinnamon. Ceylon contains dramatically lower levels of coumarin, sometimes over 1,000 times less than cassia. That's why it's considered safer for consistent use. Visually, Ceylon is lighter in color, more tan than deep reddish-brown. If you buy sticks, Ceylon sticks are thin and layered, almost like a rolled cigar made of delicate sheets. Cassia sticks are thick and hard, made from one heavy layer of bark. But most of you are buying powder. So here's what I tell my patients: If the label does not say Ceylon or Cinnamomum verum, assume it is cassia. Don't guess. Don't assume. Check the label. Ceylon is usually slightly more expensive. But when you calculate the monthly cost, it's still minimal compared to prescriptions. Now here's something else that's important: more is not better. Robert used 1 level teaspoon per meal, 3 total per day. That's a moderate therapeutic range used in several clinical studies. Taking excessive amounts will not double your results, but it could increase risk, especially if you're already on glucose-lowering medications. Cinnamon enhances insulin sensitivity. If combined with certain prescriptions, glucose could drop lower than expected. So if you're taking medication, monitor your levels carefully when introducing it. In Part 5, I'm going to explain the optimal timing window, because when you take it matters almost as much as how much you take. Cinnamon only works when it's present during digestion. This is where people make their biggest mistake. They sprinkle some into coffee once in the morning, or take a capsule randomly before bed, and then say, "It didn't work." Of course it didn't. Cinnamon's metabolic effect happens while glucose is entering your bloodstream. That means timing is everything. Here's the window I gave Robert. Take 1 level teaspoon of Ceylon cinnamon with the first few bites of each major meal. Not 30 minutes before. Not an hour later. Not randomly between meals. With the meal. Why? Because cinnamon influences 2 key processes. First, insulin receptor sensitivity. Second, the rate at which carbohydrates move through your digestive system. Both processes occur while food is being broken down and absorbed. If cinnamon isn't in your system during that moment, you lose much of its benefit. Robert started adding it directly to his food. Breakfast, stirred into oatmeal. Lunch, mixed into plain yogurt or sprinkled lightly over vegetables. Dinner, blended into soups, stews, or even added to roasted sweet potatoes. And here's something important: Ceylon cinnamon has a milder, slightly sweet flavor compared to cassia. It pairs surprisingly well with savory dishes. You don't have to turn everything into dessert. Now let's talk about dosage stability. For most adults, 2 to 3 teaspoons daily divided across meals is the practical range. If you're smaller in body weight, you may respond well to less. If you're already on insulin or medications that lower blood sugar, you must monitor levels carefully during the first 2 weeks. Because when insulin sensitivity improves, medication requirements sometimes decrease. That's not a guess. I've seen it clinically. Robert checked his glucose before meals and 2 hours after for the first 10 days. By week 2, his post-meal spikes were consistently 30 to 50 points lower than baseline. More importantly, no crashes below 85. Energy steady. Mood stable. No mid-afternoon brain fog. And this is something many doctors don't emphasize enough. Stability is more protective than perfection. Wild swings damage arteries faster than mildly elevated but stable glucose. In Part 6, I'm going to show you what happened to Robert's long-term marker, his A1C, after 3 months of consistency. 3 months after Robert began using Ceylon cinnamon consistently, we repeated his hemoglobin A1C. If you're unfamiliar, A1C reflects your average blood sugar over approximately 90 days. It's not influenced by one good week. It shows patterns. Before cinnamon, his A1C was 7.8%. That level increases risk for nerve damage, kidney stress, and vascular complications over time. After 3 months? 6.9%. That may not sound dramatic to everyone, but clinically, that's significant improvement without adding a new prescription. His fasting glucose dropped from 120 to just above 100. Post-meal peaks stayed below 160 most days. And the crashes? Gone. Now, I want to be responsible here. Cinnamon is not a miracle cure. It does not replace insulin in advanced diabetes. It does not undo years of metabolic damage overnight. But what it can do, when used properly, is improve insulin efficiency. And when insulin efficiency improves, everything downstream stabilizes. Here's something else Robert noticed. He lost 4 pounds without intentionally dieting. Why? Because reactive hypoglycemia drives cravings. When blood sugar crashes, your brain interprets it as danger. It pushes you toward quick carbohydrates. When the crashes stopped, so did the urgent sugar cravings. His appetite normalized naturally. Now let's compare that to the medication he was originally prescribed. The drug aimed to slow carbohydrate digestion in the intestine. Yes, it can reduce spikes. But it does so by leaving more undigested carbohydrates for gut bacteria to ferment. That's where the bloating and diarrhea come from. Cinnamon works differently. It enhances cellular responsiveness instead of interfering with digestion. And here's what matters long term: when insulin levels stay chronically high, fat storage increases and vascular inflammation accelerates. By improving sensitivity, you often reduce overall insulin demand. Less insulin required. Less metabolic stress. More stability. By month 3, Robert's endocrinologist reviewed his data and said, "Whatever you're doing, keep doing it." He simply smiled. Because the intervention wasn't exotic. It wasn't expensive. It wasn't complicated. It was consistent. In part 7, I'm going to give you the exact step-by-step protocol, including who should avoid this, who should speak with their doctor first, and how to monitor safely. If you're going to do this, do it correctly. Here is the exact protocol I use in my practice. Step 1. Purchase Ceylon cinnamon, labeled clearly as Cinnamomum verum. If the label simply says cinnamon, assume it's cassia and put it back. You want the lighter colored, true cinnamon, preferably sourced from Sri Lanka. Step 2. Start with 1/2 teaspoon per meal for the first 3 days. Why not jump straight to a full teaspoon? Because I want you to observe your body's response first, especially if you're already taking glucose-lowering medication. After 3 days, if your readings are stable, increase to 1 level teaspoon with each major meal. Breakfast, lunch, dinner. Consistency matters more than quantity. Step 3. Take it with the meal, not before, not after. Mix it into food whenever possible rather than swallowing dry powder. It absorbs better and is easier on the stomach when combined with fats and proteins. Step 4. Monitor your blood sugar carefully for 10 to 14 days. Check before eating. Then 2 hours after eating. You're looking for smaller post-meal peaks if fewer crashes below 80, more stable daily patterns if you notice readings dropping below 70. Speak with your physician about adjusting medication. Cinnamon enhances insulin sensitivity. It can amplify the effect of prescriptions. Now, who should use caution? If you are on insulin injections, sulfonylureas, or multiple glucose-lowering drugs, consult your doctor before increasing your dose. If you have active liver disease, confirm with your provider first, even though Ceylon is very low in coumarin. If you are pregnant or on blood thinners, discuss it with your physician. Safety is not optional. Now here's what you should expect. Within 3 to 7 days, many people notice smaller spikes. Within 2 to 4 weeks, stability improves. Within 3 months, A1C may show measurable change if you're consistent. But remember this: cinnamon is a support tool. It works best alongside balanced meals, protein inclusion, walking after eating, and adequate sleep. There is no single magic fix. But there are intelligent metabolic supports. And sometimes, they're far simpler than we're led to believe.